Hi, this is Jennifer Monahan with Health One Technologies. This video is going to review a template creator that we have developed specifically for GE Centricity. The purpose of this set of templates that we're going to show you is to give providers the ability to create their own templates within a set of standard templates. Many times organizations want to have a set of standard things that people are pointing and clicking or a way that things are stored in the system, but providers want the flexibility of having their own templates, and that's what this will allow for us to do. In addition, it does all of that without needing your IT department to do programming or an outside facility to do the programming. So everything happens within the templates themselves. You just need to have a shared drive that the templates can be backed up to make sure that things don't get lost. But other than that, there is no programming that is needed. It all happens from within the forms that I'm going to show you. We've designed these with as much flexibility as possible, and providers will have the ability to create entire templates. So, meaning that it would be their HPI, their review systems, their physical, their assessment and plan, along with some orders. Or also, it could be individual components of the template. So, for instance, if I just want an HPI template or a physical exam template, I can do it to that level as well. What I'm going to demonstrate today is basically taking I'm going to create individual components and then I'm going to tie them all in together into one big template for an entire office visit. The way this works is actually pretty simple. So whatever you enter into the HPI, so this is what will show in your specific template. And literally whatever you type in there. So if you have a specific set of questions you ask for low back pain or wrist pain or fatigue or upper respiratory infection, whatever you would normally ask, you would put that information in there. HPI can be a little tricky because it is supposed to be patient specific, but if there are things that you're typically finding or that that should be incorporated in your HPI for that template, that's what you're going to enter in there. And then you're going to come over here, and depending on your security level, you could take the option to add to the global list, or you're going to add to your personal list. And then you're going to save that. So I'm just going to call this sample HPI 2. And then when I save that, when I hit the save button, it is going to add it now to my available template. So it's an option for my HPI. So the next time any patient comes back and I want to use this particular HPI, I can just click this drop down and say use my sample HPI. You can name these whatever you want. You'll notice I have some right wrist pain, some low back pain. Again, like I said earlier, you could have fatigue or upper respiratory, whatever you want to call your available HPIs. So this is a little bit different than quick text where you have to remember what all those quick text options are. Whatever you name them, they're going to be listed as an available option for you. And then when you load them, it's going to load it into your visit. And that was the HPI. We also have the similar setup for review systems. You're going to you're going to fill out whatever you would normally ask as part of a review systems. It can be a narrative format, or if your organization says, everything has to be in a point and click format, you can come here and do this as well. So if there are things that you normally ask, you would go through and check those. If you're doing, for instance, an upper respiratory infection, maybe you want to put that they're complaining of sinus pain, and maybe there are certain things that you would normally say this patient complains of these things or denies. You would either check them or write them into these boxes. um, I'm going to just go through a couple here so that we can see them for demo purposes. There's no anxiety or depression. So then again, I'm going to save that as my sample ROS. And I'm just kind of numbering these so I remember what they are. And then when I save that, that will be available here as well. Moving on to the physical exam, you see the exact same functionality. These are my available templates already available for my physical exam. If I want to develop a new one, I can go through and select the areas that I would normally check as part of that particular template that I'm building. So I'm just going to go through and check a couple of things. Can say that this one is for some knee pain or something like that. So we can say joint tenderness. Maybe they're having problems limping. So you just go through and fill those out as you would as part of the visit, the office visit itself. And then when you're done, like I can call this my joint pain template. I'm going to click save. And that's going to now be available in my drop down. So the next time I come to do a physical exam and I have a patient with joint pain, I select that and it's only going to check those things that I've chosen already. And then the assessment plan, same kind of functionality exists. It's slightly different in that we need to have a diagnosis. So if it's already available in the patient's list because you've added it before and this is a follow-up visit, you would select it from here. If it's a new problem, so for instance, if I choose right knee pain, just kind of pick that as our diagnosis. That's then going to be available. I would write the plan associated with that. So is this a new problem? And the plan associated with right knee pain. So whatever you would normally write as your plan. You can also add in any orders or medications, patient instructions, anything like that that you would do. And then that's going to save that automatically. And once you're done with your assessment plan, then at that point, if you want to take those individual components and you want to make them into one large visit, you go to an area called Template Creator. So this will be a form that we either will include as part of your office visit. You might add it to your favorites. Lots of different places for this form to live, but this is where you can take all of those little individual components and mash them together and create one visit template if you want to do so. So the concept is exactly the same. This is what you have entered so far in this visit. So again, remember, I can do this on the fly. So if I've documented a patient visit, and I say, this is a great template for me to use, I can do that right here by just saving this information. If I need to change something, I can go back to the HPI form, go back to the review system form, make those changes. This is ultimately what my template is going to look like. So this is showing you what your HPI is going to be, your review systems, your PE, your assessment plan. And then you just name this. So just to kind of keep with our thing, I'm going to call this sample visit 2 because that's how I've been kind of naming this. You would name it however you want, whatever this particular visit is about for you. And then you're going to click the save button. And just to show you how that template's going to work, I have actually finished that visit. And now I've gone into a new patient so that I can create a different, show you how the template's going to load. And when I'm on the HPI page, remember at the beginning there is something called Encounter Template or HPI Template. So in this particular instance, I am going to load the sample visit 2 that we created, which is the entire Encounter Template. One of the things you're going to notice about this is when I do this, we had created a assessment plan for right knee pain. We added a diagnosis of right knee pain. So when I click the sample visit 2, it's going to start to load in the information, the HPI, and the other information associated with the review systems physical exam that we did. And it's also going to give us a prompt to say, this patient doesn't have knee pain, and this template is associated with knee pain. Would you like to add this diagnosis? So at this point in time, you can make that decision and say, yes, I want to add it, or no, I don't. If you click yes, it's going to go ahead and add the diagnosis of knee pain right to the patient's problem list. So this particular patient, when we get to the assessment plan, is going to have the knee pain already added with the plan that we had typed in previously. So you'll notice the HPI has been completed. The review systems is completed to what we had picked in our template. The physical is completed. The assessment and plan is done with the problem added to it. So all of that has been done basically by us creating the template, and that would be specific to the provider that created this template. So that takes care of a review of the template creator. If you have any questions, if you want to see this in a more detailed demo, please feel free to reach out to us. You can visit our website at www.h1tech.com, or you can send us an email directly at info@h1tech.com. Thank you.